everybody, it's me, Cynthia, and I want to welcome you back to my channel. Today I want to talk to you briefly and just share interaction I had with my new neurologist. So I'm new to the Austin area and establishing a relationship with a new neurologist here in this area, and I'm pretty excited about my appointment today. So number one, was excited that when this man came into the room, I could tell based on our conversations that he had actually read my chart and knew my health history. He knew that I had been on medications and which ones I had been on, and now I'm no longer on medication. So that was something that I appreciate, the fact that he actually looked up my record and knew what was going on. When he asked me why I wasn't on medication, I explained to him how I want to manage my disease holistically without the use of traditional medicine. Now, in the past, when I've shared this mind shift change with other doctors that I had been treating me, they were, shocked and very resistant, and of course explained to me how if you have MS that you have to be on some type of traditional therapy to keep things from getting worse. I got none of that with him, and so I'm really excited that that was the way that he reacted. And so he did his exam, everything is checking out, things are stable. He can see definitely with the optic neuritis, the nerve damage in my left eye, and so we talked about that a little bit, and it's nothing that I didn't already know. He also asked me if I was willing to try, or whether or not I was on vitamin D, and if not, if it turned out that my vitamin D levels were low, if I was willing to go on a vitamin D supplement. So I was kind of curious about that, and of course, yes, I told him that's a vitamin. I'm willing to try vitamin D supplement if my levels are low. So it's taking some blood. I'll have the results a little bit later today, and if my levels are low, which I suspect they will be, he'll put me on something I can get over the counter, a vitamin D supplement, and he just explained to me how much I would, based on what the test results show, how much I will need to take. So I did a little looking myself at vitamin D and what the benefit is. So vitamin D can help with energy, and vitamin D, of course, bones. I did not know that it's also good and supports the immune system, and of course MS is an autoimmune disease, so it's preventive for those folks who don't already have it. It could help because genetics and environment affect any disease that we get. So vitamin D might be helpful in that, and there's also some research going on and some studies that suggest that vitamin D aids in repair or regeneration of melanin sheaths, which you guys know that have MS is something that's affected by the disease. So I just wanted to share that with you guys. I'm going to do a follow-up once I get these test results back. Vitamin D, you can get it through nutrition. We can get it from the sun. From nutrition, it's mainly something that's going to come from dairy. I don't really do dairy. I mean, cream in my coffee sometimes, which I try to limit because it's coffee and cream and caffeine and other things that may not necessarily be that great for you. But I'm willing to take a supplement because I know I'm not going to get it from my nutrition, and we'll just see what happens. But I will follow up. I so appreciated just his approach and his willingness to do what I think always should be is a partnership between us and our doctors in managing our care. If I have to guess his age, I'm thinking he was probably late 30s to early 40s, and I think so the care is maybe a generational thing because all my other doctors were much older, probably mid-60s, and so they pushed the traditional route, whereas the younger doctors, I think, are more willing to approach things as a holistic approach and be in partnership with the patient because it's what they want to do. In fact, when I thanked him for having that approach, he said, they look at it as kind of like the Burger King thing. You can have it your way. So, and be a partner in this care. So, okay, so that's a lot, but I will follow up, and I thank you guys for stopping by. And until next time, see you soon. Bye.